Hello everyone, welcome back to my channel. I'm Dr. Soumita, pediatrician, and today we will be discussing a very important topic for your exam, and that is ITP. So many a times, many questions have been asked both in UG and PG from ITP. Please watch the video till the end so that you can answer all the questions, right? Okay, so let's know the full form of ITP. So it is Idiopathic Thrombocytopenic Purpura. Okay. Okay, so this is the most common cause of thrombocytopenia in an otherwise well looking child. Okay, so most important point here is in otherwise well looking child. This you need to remember, students. So all the children of ITP looks to be non appears to be non sick. Okay, they are well looking child. Okay, and as you know, this is an autoimmune phenomenon characterized by production of auto antibodies against platelet. Okay, GP2b 3a and GP1b. Okay, often asked as MCQ also, right? So there is a formation of autoantibodies against these two. Okay, so basically, students, ITP occurs 1 to 4 weeks after a viral infection. Okay, so as I already mentioned, this is an autoimmune phenomenon, and due to similarity between the viral antigen and the platelet, the antibody produced against the virus attacks the platelet and thus causing the destruction of the platelet. Okay, and there is a formation of platelet antibody complex which attaches to the FC receptor of macrophages in RES, thus causing the destruction of platelets in the spleen. Right, students? So, this is all about the etiopathogenesis of ITP. Often asked, okay? So, hope this is clear to you. So, next is the moving on to the clinical features. Okay, so first, when you will be asked the clinical features, first thing you need to say is the age group. So basically, the peak age group is 1 to 4 years of age. Okay, this is the peak age group. Okay, and the incidence is similar between males and females, right? One more thing is, okay, and there will be, it is manifested as what? Sudden onset purpura or petechial rashes all over the body. Okay, basically, this is characterized by what, students? Superficial bleeds, right? This you need to remember, superficial bleeds, because the bleeding in joints, that is the deep seated bleeds, are generally, it occurs due to what? Coagulation disorders, right? So superficial bleeds means bleeding on skin and in mucosa, right? And rarely there will be hematuria, okay, melena. Yes, often you get epistaxis and rarely menorrhagia. Clear? So these are the clinical features, okay? And yes, one more thing you need to add in your clinical features are what are the things which is absent. So I know whenever you get to see ITP, you often jump into splenomegaly. But splenomegaly is found only in less than 10% cases, right? And there won't be any anemia, disproportionate anemia. No, there won't be any organomegaly. There won't be any lymphadenopathy. If you are finding all these things, suppose severe anemia, organomegaly, lymphadenopathy, you will think of what? And also, if you are getting other cytopenias, which is unnatural in ITP, you will think of malignancy, right? Like leukemia. Clear? So this is all about the clinical features of ITP. Okay. Next, I'll be briefing you the newer terminologies of ITP. First, ITP means, students, you will think of acute ITP, okay? Or you may call it as newly diagnosed ITP. So what is that? If it is below 3 months, means if the diagnosis has been made before 3 months and the child has already undergone remission, okay? Then there is something called persistent ITP. So what is that? If the symptoms are persisting from 3 to 12 months duration. And there is also something called chronic ITP if the symptoms are persisting for more than 12 months duration, then you can stamp it as chronic ITP. Clear? Chronic ITP is a separate question. Okay, for PGs, definitely many a times it has been asked for PGs and UG as well. Okay, so I will be detailing chronic ITP at the end of my lecture. Right? Next is a diagnosis. How are you going to diagnose? Basically, ITP is a clinical diagnosis. Okay, you just order a CBC with platelet count, and what you will get is hemoglobin will be normal, the TLC will be normal, and platelet count will be low, that is thrombocytopenia. Okay, that's it. And are you going to order bone marrow aspiration, student? So, not required in ITP, but if you are suspecting leukemia, like as I told you, if you are getting organomegaly or lymphadenopathy, okay, or severe anemia or cytopenia, then only to rule out leukemia, you need to order a bone marrow, okay? Otherwise, you do not need to do bone marrow, right? So next is the moving on to the main part, that is your treatment. So how you are going to treat a child with ITP? Basically, you should say first in treatment you should write this is a self-limiting condition. Okay, it's benign, and you need to counsel the parents. Okay, and educate the parents regarding the benign nature of the disease. Okay, but if you find severe thrombocytopenia, suppose the platelet count has gone down below 20,000, then definitely there are chances of major bleeds like intracranial bleeds. So in this time you should definitely do some treatment. And what is that? The first drug of choice is IVIG. Okay, and what is the dose? 0.8 to 1 gram per kg. You can give it over 1 to 2 days. Okay, and what is the side effect of IVIG? Many a times asked in NEET PG as question also, MCQ also. This is, you just need to remember one thing, that is aseptic meningitis. Clear? Now, moving on to the second line of treatment, that is your corticosteroids. So, what are you going to give? You need to give prednisolone, okay, and at a dose of 1 to 4 milligram per kg per dose in divided doses, right? What these two drugs are going to do, students? These two drugs are going to do a rapid rise of platelet. Okay, there will be a rapid increase of platelet above 20,000. Clear? Next is the anti-globulin injection, right? This is given in Rh positive children, okay, and the dose here is 50 to 75 microgram per kg, right? Next is, are you going to give platelet transfusion? No. Why? Because even if you are giving platelet transfusion, then also the autoantibodies which has been produced in the body, they will bind with platelet, this platelet also, and they will cause the destruction of this platelet. So not needed in case of ITP unless the platelet counts are coming down almost below 5,000 or 10,000 and there is a severe intracranial bleed. Do not give platelet transfusion. Clear? Next question of splenectomy. Are you going to do splenectomy? Yes. In a case of chronic ITP, you will be doing splenectomy and the age should be above 4 years of age. Clear? So this is all about the management of acute ITP, right? Now, moving on to the separate entity, as I told you, you often get questions on chronic ITP. So, yes, now we will be doing chronic ITP. So, what is chronic ITP? As I told you before, also, if it's persisting for more than 12 months, and chronic ITP generally occurs above 10 years of age, generally, and in adults. Okay, and here the incidence is 2 to 3 times more in female than that of males. But in acute ITP, as I told you, males and females are equally affected, right? And if you are finding a case of chronic ITP, you should always search for a secondary cause, that is, whether the child is suffering from any primary autoimmune disorder like SLE, okay, whether the child is having any HIV, okay, and chronic ITP is also associated with infection called H. pylori. MCQ, right? Yes. So suppose you already got a case of chronic ITP. So how you are going to manage? So what is the treatment? Many a times asked. So treatment of chronic ITP is, first, yes, if you have been asked like if you are given 10 marks question on chronic treatment of chronic ITP, first you should say yes, IVIG, corticosteroids, all those, and next what they want to know from you is rituximab. This is, in this, you know, it is a monoclonal antibody against CD20, right? This is one of the treatment, and yes, TPO agonist, that is romiflostin, L thrombopag, eva thrombopag, right? These are the things you should be knowing, okay? And along with this, definitely splenectomy, this you have to mention, as I told you, should be done above 4 years. And yes, because this is a case of chronic ITP, yes, it's expected that the child will be above 4 years of age. Okay, so this is all about your ITP. And one more thing, students, generally 20% cases of acute ITP goes on to chronic ITP, right? So that's all about your ITP. I feel I have covered all the questions, every possible questions from ITP. So if you're having any doubt, just let me know in the comment box. And yes, do subscribe my channel, and we'll be meeting soon again with a lot more important topics. Thank you.